All right.
Hi, everyone. I'm Denise Louie, and welcome to Women's Health Conversations, the Smart Savvy Speaker Series. I'm here with the founder of Women's Health Conversations, Dr. Vonda Wright, and our special guest today, Dr. KMarie Reid, who's going to talk to us about how to be an advocate for your health. If you have questions for us, this is, of course, a live session and a recorded session, but please leave your messages in the chat box or in the Q&A, and we will tee those up for Dr. Reid or Dr. Wright at the end of today's session. Thanks so much.
Thank you, Denise. Hi, everybody. It's Vonda, Dr. Vonda Wright again. I'm so glad that you're coming to spend a Saturday afternoon with us. I have had the most fun talking to a lot of my doctor friends, some of my friends who aren't doctors, and really have learned amazing things. And I'm so glad that you're taking the time to be with us. But today, I have a really special person to me, Dr. KMarie Reid. I have known KMarie for longer than I think anybody else, because our story begins, I mean, we look like we're 12 now, or at least that's what I tell myself, but our story begins 20 years ago or more when we were residents at UPMC, the University of Pittsburgh. KMarie was a general surgery resident, and I was an orthopedic intern when we met, which means she was my boss. And I learned so much from her at that point about medicine, about patient care. We became really good friends. It was from Dr. Reid I learned that no matter what situation you're going into, you must wear lipstick under your mask.
To have lipstick on.
You do. It's an empowering accoutrement. So welcome today, Dr. Reid. We're so excited to have you.
I'm so happy to be here at Women's Health Conversations, chatting with you, Vonda. And yes, Vonda and I are great friends, and so this is really exciting for us to chat today.
Well, I'm glad to have you. And then, you know, that reminded me that several years ago, you had come live to Women's Health Conversations, to our big conference in Pittsburgh, where you won a Health Transformation Award, because and we can talk about that today, the transformation you made in your own health and how you paid attention and invested every day in yourself. As an advocate for yourself, it's kind of all the same a stream of thought, but something that's really important to you, and you've talked to me a lot about, and you do every single day, is advocate for patients. So I think we should dial it way back. What is advocacy? Why is it important? Why do you have to stick up for yourself and not just take anybody's advice? Talk to us about all that.
Healthcare is really transformed from a patient perspective. I remember going to the doctor with my grandmother as a child, and neither of us knew anything that was going on. She didn't ask questions. They told her what to do. They just set appointments up, and I went with my grandmother to those appointments. Now, people are more informed. They're coming better prepared, and they are advocating for their selves. They are asking tough questions. They are saying, I don't want you to be my doctor. And they're saying, well, I looked it up on the internet, and that's not what the internet said. And then the toughest part of my job, working in a safety net hospital, are patients who come in who have family members who tell them not to get health care, and that if they do get some sort of health care, the doctors are practicing on them, or that their cancer can get worse. So advocacy really is taking a stand for your health and understanding that you are truly a partner in the decisions that are being made to take care of yourself.
That's right. And so I want to explain a few words that you had said there, because people get their health care at a lot of different places, but right. In the places you and I were trained, and KMarie currently works for Morehouse and runs divisions of surgery for Grady Hospital in Atlanta, which is a tertiary hospital. That means that you still have residents and fellows and are training people. So that may be some of the response that people have coming there, but I certainly would uphold the fact that you get some of your best medicine in that kind of setting.
Absolutely. The academic setting, which is charged with training the next generation of physicians and nurses and physician assistants. These centers are critical to keep that pipeline of doctors coming through. And so some patients may be shy about getting care. They think that the professional and the fully trained surgeon or physician may not be the ones making the decisions, but they really are always the ones making the decisions.
That's right. So let's go back to, I love the story of you going with your grandma and understanding that now people are not just showing up and saying, well, you're the doctor, do whatever.
Well, we still have some of that, which I caution them against.
Yeah, but we've been in medicine so long, we don't realize that for some people, their knee, or in your case, Dr. Reid is a hepatobiliary surgeon trained at the Mayo for her fellowship. People don't even know where their liver is, let alone what it does. And, right? So it's a completely different language. So how can you advocate for yourself when you don't even know the language? You think, it's like speaking French. It literally is a different vocabulary. So walk us through the steps. What do people have to know when they're first choosing a doctor? How do you choose a doctor?
I'm going to give a shout out to one of my good friends, Patricia Turner, who's head of member services for the American College of Surgeons. And she is responsible for signing off on physicians or surgeons, in my case, who are board certified. That means they have completed their training and they have taken one, perhaps two post-training exams that are pretty rigorous. Some are written, some components are written, and then the others are like you and I, they're tested orally, and they have to defend their decisions. And then they get a designation called they're a fellow of the American College of Surgeons, or whatever group of physicians they're aligned with. Right. So a board certified physician is that type of physician. And now the board has moved to testing everyone every year to test their skill set and their knowledge. And then every hospital is responsible for, quote, credentialing surgeons and physicians. So they have to look to see how many cases they've done, how many people they've trained with, where have they trained, is the training consistent with the norms and expectations, do they have prior lawsuits against them or were sued, and what is their quality of care that they deliver. So you need to look at that, and looking at where people train is one step that you can take. If you have a family member or friend who've had a great experience with another physician, that's another good place that you can go to. Or you can go to the societies of the different fields. So I'm a liver and pancreas surgeon. We have a society. They can also make recommendations for you to get your care. But what you really want to seek is the specialist that can take care of the disease process that you have. That is critical.
So even if you just need a primary care doctor, the bare minimum is, and I know you'll agree with me because you just said it, you must go to a board certified doctor. They must have done the hard work to pass all those exams. It's not enough just to get through medical school. It is not enough just to do a residency. You must find someone who carries a board certification. And that's easy to find on the internet. Every state board will list those. Number two, if you have a specialized problem, you want someone who's not only board certified in medicine, you want them certified in their subspecialty if there is one. And so how that works for orthopedics is I'm board certified in orthopedics. And then in my specialty, and not all specialties have this, there's a second certification if you want to claim to be sports medicine because you did a fellowship, right? So, and those, I'm sure it's the same in general surgery, you have to maintain those. It's called maintenance of certification. Once in a lifetime doesn't cut it. So that is the minimum thing people have to do. So let's say you found the right doctor, or you found a list of right doctors. How do you choose the one that works for you?
I'm going to tell you how I choose the ones that work for me. And I'm open and honest about it. Sometimes I want a doctor who looks like me. And so I may want a female physician. So if I want to go to an OBGYN, I want to have a woman who's going to understand. And for me now going through menopause, I want a woman who understands what it's like to go through menopause.
That's right.
So I recently did some changes to my physician profile, and that's one of the things that I look for. You may want to look along alignments of where you went to school or you've trained. That may help you to understand what type of physician that is. But really choosing a physician that can deliver the care that you need. Even with primary care physicians, you may think that every primary care do the same thing, but there may be some physicians who love the practice of treating women with high blood pressure or men with high blood pressure, or they are really focused in on diabetes care. So you want to get that person with that focus because they're continuing to enhance their education and get new information when there are changes in the field.
Well, and that's really important. And I tend to use some of the same criteria when I choose my own doctors. Another criteria that I use not only for my patients, but for myself is I have to get along with my doctor. And
yes,
some patients think that
yes,
you just take whatever you get. But if you're a person that needs a conversation, that needs understanding, that wants to be treated as a collaborator, you need to find a doctor that will talk to you, even if you're looking for a surgeon. Because talk about that, KMarie. Surgeons get this reputation for, well, at least as long as they can do the procedure.
No, you really want that surgeon to have that ability to allow you to understand what they're speaking about. We're talking about very difficult conversations sometimes, and you want to have a surgeon who is caring, thoughtful, who are going to advocate for you with the hospital or with your healthcare if things aren't going well. You want to have that connection. So saying that, oh, I heard he or she is a good surgeon, but they have poor bedside manner, or they do not advocate for you, they don't return your phone calls. If before surgery, they're not returning your phone calls, or their office isn't returning your phone call, what do you think is going to happen after you've had your surgical procedures? It's probably going to be the same. So you have to have that connection just like any other relationship, and you must have trust.
That's right. And so there are a few instances where your health is so serious and what you need is so emergent that you might just have to go with the person who can fix you today. However, the best case scenario is not to meet your doctor the day you're in an emergency. So, and we're both surgeons, so sometimes that's unrealistic, but definitely when it comes to primary care, the time to meet your doctor is not in an emergency. You want to do this with good timing. You want to interview these people. You want to have a relationship already so that when you do have an emergency and you call them, they're not like, who are you again? Right? So you have to do this ahead of time as the advocacy. So let's say you do get sick. KMarie, you're very close to my parents. So you know that both of them have been sick this year. And, I'm truly in the middle of a sandwich generation, taking care of them as I take care of Isabella, who is also very close to you. But let's talk about advocacy during illness and what that should look like and what that means.
One of the things I highlight all the time is to walk into your doctor's appointment much like you do on an interview. You are going to be prepared. I want you to write down your questions. I want you to write down your symptoms. Please have a list of your past medical problems, your medication. It really helps the interview to go better. And if it's critical, and by that I mean you have a new diagnosis that you don't understand, you may need surgery, you have a cancer or something extreme like that, please bring family members with you, one or more. Because if a doctor says to you, you have cancer, You stop listening at that point, and everything after that goes right over your head. Mm-hmm. And so you need that family member or best friend or trusted person with you to write notes, to advocate for you, to ask questions, to clarify, so that when you go home and you are now willing and ready to hear and receive more information, they will have it for you. Mm-hmm. So write everything down. Keep track of all your health care. If you have, I always tell people, if you have images on a disc or CD, hand carry it.
That's right. Don't send
it. The hospitals are working well together, not necessarily. Hand carry it and take it into the doctor that you're about to see.
That's it. Well, and to expand on that, not only be prepared, but, and I have the advantage of knowing how to do a history and physical, obviously, but because my parents' medical history has become so complex,
right.
I can't remember everything. So I now keep a Word document and I update it. This is who we saw. This is what happened. This is the name of the doctor. And because there's a lot of times, and and I'm an orthopedic surgeon who does sports medicine. So unless I'm on trauma call, I'm not saving lives. But even in simple things like knee surgeries, people will often say to me, I had some kind of surgery and I don't know who did it. Well, right. I think, when it becomes more critical, or when your medical care becomes more complex, or even when it's keeping track of when you had your babies and who delivered them and where was that and were you allergic to anesthesia or that kind of thing, write it down.
Just write it down.
It's okay to hand the nurse in the room your piece of paper.
That's right.
And bring your drugs in a bag. They do appreciate it.
Bring your drugs
in
your
medicines.
And write on an index card, write it in the notes section of your phone. The great thing is that a lot of our smartphones now are linked. So you can capture your allergies, your medications, your next of kin information in your phone, and that medical personnel can retrieve it from your phone. So use those capabilities that we have at our fingertips. If you want to put it on an index card, great. Some of my older patients bring in their index cards with their information. If you want a binder and put it all in a binder, that's a bit much. I'm not reading all the things in your binder. Do it for you so that you can remember and keep track of everything.
That's right. Do it for you. We're urging you to advocate for you.
That's
so. Right. You've taught somebody how to find a doctor. You've taught somebody how to keep track of their medical information. And they're sitting in the doctor's office. Give us some words or advice on, let's say you're not getting all the information you need, or the doctor's got their hand on the doorknob the whole visit. People are afraid to ask, but as a surgeon, KMarie, give people words to say, because people are trying to be polite to their doctors. They don't want to bother them.
But yes, it's really interesting. It's really interesting. When I see a patient that's on my calendar coming in, and I know it's a tough diagnosis, like pancreas cancer, I have my nurse call them and say, I want you to bring a family member with you. They sometimes push back and say, I don't need anyone with me. And I push back a little more. No, you need someone with you. Then what I do is I do a lot of diagramming throughout the case, throughout the discussion, and I bring up their actual images and show them. It's another way to build trust, right? Because if they can see what you're seeing, they don't have to go home when they're challenged by their family and say, did you really have that mass in your liver? Yeah, I saw it. I saw it. I do have the mass. I do need the surgery. And then ask the doctor for reading materials so that when you go home, you have resources that you can go to. A lot of times I recommend 2 sites. If they have cancer, cancer.gov is ran by a very important organization from the government, the NIH, and they give advice on every type of cancers. There are information for doctors and for patients. And then Mayo Clinic, where I've worked in the past, has a great website, patient education website that is great and well trusted. You go there after your visit, or better yet, before your visit, and read up about what it is that you think is going on so that you can ask those tough questions. Whatever comes to mind, ask. There's no bad question.
And if you are asking those questions and you're not getting the understanding you need, I'm going to give you permission to say to your doctor, "Doctor, I just need you to say it again. I need you to explain it to me again." If you feel like you need to be polite, we are in the South, you can say, "I know you're busy. However, I need to hear it again." Just stop the moment, because this is your healthcare and this is what advocacy is about.
And many doctors have nurses in their practice that this is a part of their job, which is the patient education piece. And so you could say, "Can I speak to your nurse after?" Or is there another person member of your team that can spend additional time with me? But really ask for what it is that you need. Don't be shy.
That's right. So what happens and I've had to do this for my parents, going into a doctor's office is one thing, and not speaking the medical language. But if someone's sick enough that they have to be in the hospital or the ICU, and it's really not your environment, and it's really just intimidating because of the surroundings, and in a really critical situation, because doctors are so specialized and we work in teams. And this happened. My mother was in the ICU in March. I don't mind if anybody knows this. And when my parents go into the ICU, I tend to live there with them because it's so confusing.
That's important.
I do. I spend day and night there. But for a lay person, teams of doctors come in continuously.
Yeah.
And so when I would say, "Okay, who was here while I was gone?"
Right. They often don't know.
Right. So I have gone so far in advocating for my parents to ask for a plan of care meeting. To have everybody in the room. Can I please understand the plan of care? Let's empower people listening to do that. How should they do that?
So if you're in the hospital, number one, I recommend that if you have a family member in the hospital, someone should be there with them most times. The doctors come around to see patients usually early in the morning so that they can start their day in the operating room or seeing patients in their clinics. So what you want to do is really make sure that you're there, or leave your phone number on a paper or on the whiteboard, which is usually in the hospital room, so the physicians can contact you if needed. The other thing to do is, if you're in the intensive care unit, there are so many different teams of physicians, nurses, physical therapists, occupational therapists taking care of your patient, your loved one, that you can ask for a meeting with all the representatives so that they can help you understand where the status of care is and what the expectation is moving forward. This is especially critical if your loved one is really sick. You want to have a sit-down conversation with everyone. You want them to block a time, 1 p.m., 9 a.m., where the family members can attend, and it's as many as you need to be there so you can understand. And asking questions is not a bad thing. Most healthcare providers are more than willing to make sure that family members are keeping up with what's going on with their loved ones.
And that's especially true, I find, in my experience, when I may be getting different information from different teams.
Right.
Because it's not that they don't eventually talk to each other.
Right.
But they might not have talked to each other yet.
That's right.
So if there's different teams, but I want to address a sticky subject and just give advice, because healthcare has changed. Now, when you and I were training, it was a different time. When I was a nurse in the 90s, it was a very different time. During those times, if you had a patient who you took care of in your office, when they went into the hospital, you were still their doctor.
That's right.
But now medicine has shifted, and not everywhere. Lots of PCPs still take care of their patients, but there is now an entity called a hospitalist, and sometimes even a surgicalist.
And an OB,
and an OBist, or
yeah.
And what that means is they are not your doctor on an outpatient. They only take care of you when you darken the doors of a hospital.
Right.
So, and because medical information does not always flow seamlessly from an outpatient office to a hospital and back,
right.
It makes self-advocacy
critical,
mandatory.
Critical.
Because hospitalists, although board certified doctors, they are good at their job. They don't know you. All they know is the data in the moment.
That's right. And they won't take care of you after you leave the hospital.
That's right.
So if you do have a family member that is in the hospital, I wanted to go back a little bit about care. Mm-hmm. If you don't like your doctor, get a new one. Get a new one. Ask for a second opinion. And to me, a second opinion really means that you're leaving that practice to another practice. Because the doctor.
Well, you're not just going to your partner?
No, I don't recommend that you just go to my partner, or because we all usually think alike, and I'm going to go to the room and call you and say, she doesn't like me, so. So get a new one, get a new doctor, and that physician is required by law to assist you and cannot abandon you if you request to have another physician care for you. And you can get a second opinion and get your care from that person who gave you the first opinion,
yes,
or the person who gave you the second opinion.
And you shouldn't feel guilty.
You should not feel guilty. You should not feel guilty. You need to really do the best thing that's right for you.
Well, and yes, and I completely agree. You are welcome to ask for a second opinion. And sometimes patients are shy about that. And what I say to my patients is, a good doctor, and whether it's a personality thing or they just need confirmation, these are the exact words I say. A good doctor is never offended by a second opinion. And I am never offended by a second opinion because I'm confident in what I've told you. I have given you my best opinion. Right. And if you need confirmation or to hear something else, I'm going to empower you to do that. I'm not offended.
Sometimes, I've had the rare patient who didn't get along with me. Mm-hmm. And I figured out why later. They didn't want a Black woman. They didn't want a woman taking care of them. And that's their right. But I've always, sometimes if I even feel a level of discomfort during the conversation, I will recommend a second opinion, because the last thing you want to do is operate on a patient who doesn't trust you or feel comfortable with you. Yes. That's not the environment that you want. And so I ask them to take time to come back or get a second opinion. And that's me trying to help them, even if they can't, verbalize that that's an issue for them.
Yes. No, I completely agree with that. And it goes back to, this is a partnership. Today's medicine is a partnership. It's no longer the old guy in the white coat coming in the room and telling you what to do. It's a partnership. And patients get better that way.
They do get better. And I'll say to a patient, for example, you want me to help you with this disease, but what I need from you is to stop smoking, to lose some weight. And this is a partnership. This is not all on me. Both come to the table with what we, responsibilities for this relationship. And so that's also a part of being a patient is taking on your half of the
I love that. Being an active participant. It's your body, it's your brain, it's your family. That's it.
Doctors can write prescriptions, but if you're not taking them, or you're not coming into the appointments, you're not, following through with the tests that they recommend, you're not going to get the best care.
Yeah. So we have talked, KMarie, about the qualifications of doctors, where to find them, how to interview them, how to prepare for a visit. We've talked about the hospital setting. We've now just spoken about a second opinion. What are the final things patients need to do to be great advocates for their own health?
Be healthy. You be healthy. Do the best you can. During the COVID epidemic, I started to gain more weight. And I said to Bobby, my fiance, okay, it's time for us to get back on it. Every day we have to exercise, lower the carbohydrates. My doctors can do everything to help me, but if I'm not helping myself, there is no benefit to any of it, including the medications. Right. So be healthy. That is your best way to be your best healthcare advocate. Choose healthy choices.
I love that. I love that so much. And I'm with you, my friend. I had to actually stop baking sourdough bread.
Yes,
because I was eating too much of it.
Pictures of the sourdough bread, and I'm like salivating.
I know. So I'm going to bring back Denise Cylon Louie, who's there. She is.
There I am.
There you go.
I've been enjoying the conversation. You should not have mentioned sourdough bread. Now I'm hungry too. Anyway, so I have a very important question, follow-up question. I'm well aware of situations where a patient is sitting with their doctor and they're getting that news that shocks them, right? And yes, have a family member with you for that conversation. But do doctors already have written up, some supporting materials that speak about the diagnosis that they could automatically hand over? Or is it always a situation where you're stuck taking notes only? How, do they hand over the materials? Because I'm thinking, you're in such a state of shock. You're hearing, and maybe even the person you brought along with you is also in a state of shock. So you're hearing half of what's being said if you hear any of it. Right. And you're going to end up having a follow-up appointment, but how do you bridge the gap between only hearing half of what was said before the next appointment is made? What else could you do to help kind of close that gap of knowledge?
Many physician offices do have educational materials that are readily available. They can print it out from their electronic medical records, which usually have that content, or they can print it off from the internet. But as I said earlier, I give patients resources outside of what I give them, patient-directed resources. So say you have pancreatic cancer, there are pancreatic cancer support groups. And I want them to know about that so that they can go there and gain information or even meet other survivors who can help them navigate their care. Other things that I do in my practice is to sometimes introduce patients to each other. And I tend to do that with their permission if they have a rare disease. So if a young person comes in with pancreas cancer and I have another young person who's been through it, that might be a situation where I consider pairing those patients to help each other, because they're so young, they're not expecting even to be sick, much less being sick with an advanced disease. So, and asking for another visit to continue to explore what the physician said is in your right. You can ask for a follow-up appointment, another appointment, or a visit with their nurse to help improve their fund of knowledge. So, yes.
I like that point, though, to schedule even a follow-up meeting with the nurse, right? Because, then, and maybe, those individuals who, whether they're intimidated by their doctor or just for whatever reason, sensitive to the doctor's time, they may feel a lot more comfortable talking to the nurse, perhaps. And, and it could be a more casual conversation, a more easy flowing conversation as a result. I like that tip. So my next question, I have a friend who has a family member who's got multiple issues going on, and can no longer really be an advocate for himself. So she needs to be that person for them. And I'm talking, they're probably dealing with 5 or 6 specialists at any given time. So what advice would you give? Because she feel like she almost has to become a medical expert herself, or so it feels, to coordinate all of this knowledge about, well, he's on this medication and this is when it started and this is with the symptoms that he's had and it started on this date, but he also has this medication that he's coming off of. And
I think in those instances, there needs to be a quarterback to the care. And I use that language. Someone has to be the quarterback that is instructing, merging information, and that person is not the family member. It's usually one of the physicians, and it's usually the primary care physician. Or if it's in a cancer situation, it's the medical oncologist. And if that's not happening, you need to say, hey, I need someone to quarterback this care and integrate all of the things that we are hearing and learning and all the changes that's going on. And just making sure after every visit, they get a post-visit summary of the medications they should be on, the next appointments that are coming up. And most of our new electronic medical records help, doctors' offices do this. So this is not a stretch to ask for this information.
yeah. So even when you are identifying, your next or your new primary care physician, you might even want to anticipate that this could be a situation you're in one day, and what sort of services do they provide to facilitate that? That would be a good question to ask, I'm hearing.
If this person doesn't have a primary care physician, they should get one.
Yes, they should get one, yes.
But they usually are the ones who play this quarterback role.
Right. Okay.
Well, and that will go into, I have used that exact language, KMarie, when my parents were recently in the hospital, because I felt like people were assuming that I would quarterback because I'm a surgeon, but I can't I'm smart, guys, but I don't know everything about everything. So I need an actual primary care quarterback who does know a lot about everything. And I use that language when I asked for the family care conference. I said, I need a quarterback. I cannot quarterback this myself.
That's right.
But what I'm about to say goes back to how you choose your primary care doctor. If you have a complex medical history and you have to go, and you know that intermittently you go into the hospital, maybe you need to choose a primary care doctor who still admits their own patients. Right. Because otherwise you are going to be handed off to a hospitalist and they'll quarterback for you while we're there. But if you're really complex like that, Denise, you need one person.
Yes.
Yeah. No, that's good advice. Because the healthcare system has gotten complex, and I'm based here in Ohio. There's several very good, one incredibly good, as we all know, healthcare system here in Ohio. But I know some specialists that people call upon might be from different systems. And how do you coordinate that? Right. You'd like to think that, but between your health insurance changing and doctors coming and going, you may not necessarily have everybody that you work with be in the same system coordinating. So that's very good advice.
You have to be so organized. In that.
Yeah, right. Which makes me think there's an opportunity here for an app or something that helps you,
say that. So most of the medical record systems like Epic and Cerner have a My Chart or an app where they can communicate with you and you could see your test results and you can ask for a prescription refill. It's mind-boggling how many patients don't utilize those apps.
Yes.
So they should download the apps for their organizations and they will send them reminders through the apps for their appointments and when there's a prescription change and communicate test results. So the app is a good way to help organize what it is that you're going through medically.
Yes, I have a couple of those on my phone, and I do agree that I think they've been very, very helpful. But yeah, okay. Let's see here. I checked it. We had one question that had come in, but you guys had spoken to that earlier, so I don't know if the individual was a late participant in today's video. But are you ready for rapid fire questions?
Sure.
Okay.
Does that mean I have to just say yes or no?
All right. Come in no matter what. All right. So, okay, we did talk just a little bit about an app, but are there other, like maybe not affiliated with a particular hospital, but a favorite app or a favorite health book that you have been suggesting to patients and family and friends that would really help elevate their just overall medical knowledge?
You know what's good and easy? Wikipedia. I love Wikipedia. Wikipedia has a lot of answers for everything. And Google has gotten better in curating responses. You know, they pull the more trusted sites to the top of the answer chain. So, Vonda, you are a participant with one of the very good apps. WebMD is a good app. The Mayo Clinic website is a good site. The hospital-specific sites often have patient content information. ShareCare, that's what I was.
ShareCare.
Yeah. ShareCare is another good one. So, but Wikipedia works too.
Okay, good to know. What is the best thing that patients can do before they have an appointment to prepare for a health crisis?
If they know what the issue is, it's a lot easier for them to prepare. So say they are coming in for an inguinal hernia, they can read on that. But if they're having generalized abdominal pain, they can really get down a rabbit hole because they don't know what it is that's going on. So I caution them then to wait till they get to the physician. But if they know exactly what the problem is, it's a little bit better to, you know, have some directed learning in that way. If they don't, please don't go down the rabbit hole bringing the doctor a stack of Google printouts with 10, 20 diagnoses.
Is it my liver? Is it my spleen? Is it my gallbladder? Is it my intestines? Is it my stomach? Yeah, okay.
That's right.
I gotcha. Okay. What is the most surprising thing that you have learned from your patients here in the most recent years?
From my patients, you know, they're so vulnerable. The level of vulnerability is deeper than sometimes I even understand. You know, they come into a health system sometimes where they don't know where to park. They're anxious about their visit. They don't know how to navigate the hospital. They don't know this surgeon. They can't look them up beforehand, you know, and they come in just wide open, vulnerable. And for me, the most important thing is making sure I establish trust in that visit. The other thing is dealing with African-American communities who have, for great reasons, and maybe this can be another conversation, distrust of healthcare. And so they wait for a very long time before they come in. And so, you know, it's always shocking some of the level of disease that I see because it's usually end stage and there's not much that I can do as a surgeon. So I encourage everyone who can hear this to, as soon as you start having problems, don't expect it to go away. The signs, the pain, the symptoms of nausea or vomiting are all the body signs and language to tell you something isn't right. So go in and get it taken care
of. Yeah. What is the most common helpful tip that you have given to family, friends, colleagues regarding health?
Stop smoking. Smoking is the cause of so many medical problems. And in the world of surgery, not only does it lead to a lot of the problems that I treat, like cancers, pancreatitis, it also delays healing. It leads to higher rates of complications after surgery. Patients just don't get better in the same way as if they didn't smoke. So, you know, try not to choose to smoke. Just try not to get into it at all.
Mm-hmm. Okay. Let's see here. And again, those who are online, you feel free to tee up a chat question here. Some of my questions you guys have addressed, so you guys covered some good ground, I should say.
Good job. That's good.
Yeah. Well, let's see
You know
here.
what I want you to describe before Denise, I'm pivoting a bit, but before Denise asks you her last questions, I happen to work in a hospital setting where as I said before, I'm not saving lives, I'm saving lifestyles. And so we've made vast adjustments for COVID, but you work in the flagship of the city when it comes to acute critical care. And so are you doing okay? I mean,
We are doing okay.
Yeah.
Yes, we are doing okay. It's a scary time for everyone, and it's a scary time for the providers, and the hospital system has done a remarkable job in making sure that providers have the PPE that they need, and that we are thoughtful about how we cut back initially the care that we deliver to only really essential care, and spend many hours in a day thinking about how we're going to reopen and have access. But, you know, as you've heard, we are dealing with COVID, but traumas are up, and, you know, people are getting into critical conditions from that. So the hospital is full, and it's not all with COVID patients. So it's a busy time. It's you know, the frontline staff are very concerned about their personal health, because not a lot is understood about that, but we are doing okay.
Good. Okay.
Thank you for asking.
I wanted to check in on you since you're on the front lines and I'm on the back lines. But anyway.
I'm more administrative now, so I'm not so much on the front line all the time, but definitely I'm responsible for a lot of people on the front lines.
That's it.
So this isn't necessarily a rapid fire question, but do you see medicine evolving, like really for any of the doctors, for no matter what their specialty is? Do you see more of an emphasis through training or through just simply awareness, the psychological side of patient care? Do you see, you know, because people come in perhaps more stressed than they were 10 years ago, 20 years ago, because of their health situation, because they have more knowledge coming into the meeting, maybe because of their financial situation. Do you see more of an emphasis on the psychological aspect of the care among the specialists?
For me personally, I see it. I spend a lot of time focused on that and trying to treat the whole patient. But, you know, there's a lot of burdensome tasks in a physician's practice and daily life that may take away from that. A lot of the work that we do with the electronic medical records, before we would have help with writing some of the notes or the prescriptions or doing the billing, and now it's squarely on the laps of the providers, which is probably why patients go into a room and their doctors are typing away, because they have only that moment in a day to be able to get the work done for that patient. So unfortunately, I don't see a shift more in that direction. If anything, I see a shift more in the opposite direction. And if you have a busy practice like Dr. Wright sees how many patients a day, you could see up to 40, 60 patients in a day, you know, that you're moving very fast. So that's why it's important to have a primary care doctor who really can, you know, do a lot of that quarterbacking for you, because your specialists are quite busy. They all are.
Yeah. I mean, this is actually like a fascinating conversation, because some of this is just my general growing awareness about medicine and my interest in the subject and desire to know more, and having a family and trying to take care of them. But part of it I didn't realize was also a change happening in the healthcare industry.
Absolutely.
That, given what you had said, does put more onus on the patient themselves, or the patient as an advocate for their child, their husband, their parent.
COVID has pushed the innovation a little forward. Telemedicine we learned that telemedicine is so much better for the patients that I take care of, who don't have the time to take from work, you know, to come to a doctor's visit, and can't afford parking and can't afford daycare or don't have daycare. So I expect that after COVID, a lot of practices are now geared and ready to go to practice telemedicine. Telemedicine, and the Centers for Medicare and Medicaid have now allowed for equal visits for telemedicine as they are in person. So there's definitely going to be a shift of how care is delivered in the future.
So we had a question that came in. So this is from Michelle. Michelle says, technology is trying to disrupt the industry with online diagnosis. How reliable is that technology at the moment? Thanks, Michelle.
I think for straightforward issues, you have some heartburn, how do you treat that? That maybe online diagnosis and working with a physician online is easy. What really is a problem is when you need surgery or you need to see a specialist, and it's a more complicated process. Early reflux disease and late reflux disease is a total different issue. So for simple things, a headache, a cold, not COVID, a cold, you can do online with early diagnosis and recommendations, or even calling in and speaking with the nurse advisor. But really more complex things that's causing you to not be able to go to work, needing time off to stay at home, you're debilitated, you're losing weight. These are all major symptoms that need to be addressed properly with a person, with a physician.
Right. And sometimes, as you were saying, if it's more of the minor items, quite possibly you have that conversation with your doctor, they order blood work.
Absolutely.
Do you need to physically come in for that conversation, or can that very easily be done over the phone? Right. And I would think that could.
Some of the things that should not be ignored is pain that doesn't go away. And weight loss. Weight loss is cancer. Unintended weight loss is cancer until proven otherwise.
Okay, good to know. Okay, well, I have one final question for you. We have been asking of all of our participants in the series, what advice would you give to your younger self?
I would tell my younger self, you're doing great, girl. Just keep on doing what you're doing. Don't worry so hard.
Oh, I love that answer. That is great.
We all need a cheerleader.
Yeah, you're doing good. Sometimes, we're so hard on ourselves, but looking back at my younger self, I've made a lot of good choices that have set me up for my current self. So I wouldn't change anything about it.
I love that answer. And I've known you since you were younger, so I know you're right.
We've seen the trajectory, right?
I've seen it. I mean, we're just going to have to come back to talk to you more, because what we haven't explained to all of our viewers is you have such an interesting history. You were a soldier, for God's sake.
Yeah.
I know. Isn't that interesting? So tune in next time.
What?
So, what's funny, when I meet my medical students, I would say, Nate, give me one thing that others wouldn't know about you. And what my thing was always that I was a part of Operation Desert Shield. So as I've gotten older, this is the face I get when I say that.
Yeah, they don't know what it is.
What Operation Desert Shield is.
I know.
You got a badge for that?
That was from 1990, and they have no clue. So,
no.
It's something else to say to my current medical.
You should have told them to drop and give me 20. Anybody who does not know the answer to that, drop and give me 20.
That's right.
Well, I am so thankful you were here today, Denise. I'm so thankful you were here again with us today. And we only have 2 more sessions of Women's Health Conversations Speaker Series, but it has been an amazing 8 weeks for us. So Dr. KMarie Reid, I'm so thankful you joined us today. Denise, thank you again. And we'll see you again next Thursday. Bye.
Nice to see you again, Denise.
Take care. Bye-bye.